So we know that treatment for AML is very costly. Despite that, we are currently mostly using the old intensive therapy that was developed during the 1970s. These drugs are long past patent. But very recently there have come a numerous number of new drugs that will be very expensive. But we wanted to look at what drives the costs for treatment of acute myeloid leukemia. In Sweden we have lots of registries, so we checked all AML patients diagnosed in Sweden from 2007 to 2015, and that was almost 3,000 patients. And the patients were identified through the Swedish AML registry, which keeps track on date of diagnosis and date for start of treatment and which type of treatment, complete remission, transplant and death and everything around that. But we also have the national registries that keeps track on hospitalizations and cost for hospitalizations, cost for sick leave and early retirement, and the costs for outpatient treatment and prescribed drugs. So we put all these data together, and we came out with lots of data. And young patients are more costly than old patients, of course, because the ambition to cure the disease is stronger in young patients. So for a patient below 60 years of age, the overall cost over 5 years is about $175,000. For patients that also undergo stem cell transplantation, the cost will rise to about $250,000. And an interesting finding is that more than 60% of these young patients, the cost of these young patients' treatment is hospitalization, and about 20% is early retirement and sick leave. And the rest of 20% is other types of costs. So it's very much driven by hospitalization. For older patients, it's even higher percentage of the cost is hospitalization. So now we know that there are many new drugs, and some of them are given mainly to older patients. Many of these are oral only and gives good results. And if we can prevent hospitalization and have more treatment as outpatients, that would likely reduce cost for hospitalization and that type of treatment, although the cost for drugs will increase considerably. But we think that this data is worthwhile. We have checked that the cost from start of treatment to complete remission is the highest cost per day, but the highest overall cost is for the transplant patients that live very long following the transplant. So we will report these data specifically in due time.